Good afternoon. My name is Scott McGann. It's June 5th, 2020. I'm with the Falmouth Health Department and doing our weekly COVID-19 update for Falmouth. Again, the Falmouth Health Department's email is www.falmouthmass.us. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So in the recap, I'm going to start. There's been about 185 cases since March 1st. About 87 of the total number of cases are no longer in isolation, which is about 161 of the 185. If you take out long-term care, we're about 90%, 97% out of isolation. So there's very little activity going on in general, and definitely if you take out the long-term care. Falmouth has approximately 12.8% of all cases in Barnstable County, which is definitely down from early April of 23%. That was the highest that we were as a percentage of all cases in Barnstable. And again, we continue to do contact tracing, especially seriously aggressive. Now that the case number is lower, we can be more aggressive in trying to really get down into the individual cases. Because what you're trying to avoid now are flare-ups. So that's where we're at, and that's in good shape. If you look at the next chart, you can see that our cases are lower. You can see back at the end of March, early April, we were averaging between 30 and 40 cases a week. We got down around the 10 to 15 range for a longer, had a little bit of spike in mid-May due to long-term care, but since then we're down low. And all the cases that we've had over like the past 10 days to 2 weeks have all been pretty much from long-term care. So in that case, we're doing quite well. Again, from the beginning of the outbreak, you can see where we've tailed off. Our outbreaks, those are just each one of those little dots represents a case count for that particular day, and you can see that we've definitely tailed off. And again, around April 10th, we were really going hard and fast on that, and we've definitely so quote unquote flattened the curve. This is the state's website. It's updated daily. It's the COVID dashboard right around 4 o'clock. You can see that the red, green, and yellow lights that we have, the dots, indicate that trends are in a good direction. This is June 1st. They update that on a weekly basis. We don't have any negative trends. We have some that were in the yellow, that were in progress. We want to get them to green. Looking at the total number of cases, I'm going to flip over to the next slide. On the left, you'll see that that's what we've been using. The state has now added probables and antibody tests into the dashboard. But what we were looking at all along when I was showing it is the confirmed. That's with the nasal swab molecular test. And those are 412 for yesterday, 50 deaths. Total number of confirmed cases slightly under 100,000. Total deaths around 7,000. So you can definitely see a flat line. Last week, I think it was somewhere around 700 and between 80 and 90 deaths. So we're definitely continuing in a downward trend. Also from the dashboard, that you can see that all the metrics that we're looking at, the testing rate is at 5.7%. We really want to see that under 5, but it is trending in the right direction, albeit slowly. So it's an 80% reduction from the beginning of May. Average number of patients in the hospital, which at the beginning of May averaged around 3,500, is now down half that, 54% down to 1,659. And that continues on a downward trend. And I've been telling you all along that's really one of the more important ones to look at. Surge capacity is definitely down, 76% from the beginning of May, so a month ago. There's currently 5 hospitals using surge capacity. So that's areas where there's still a high rate of infection. And deaths are down from 136 average on the first week of May 5th through 7th, to the 7th, down to 50. So there's been 50 to now 43 when they've last did this on June 1st, and that's a 72% reduction. So all the markers are in good shape. By county, you can see Barnstable County had 1,443 total number of cases. We've been flat for quite some time, and hopefully that's from all the hard work everybody's doing with the social distancing. And that's where we're at for our county. Falmouth compared to the state in terms of infections, we've had 185. Like I said, that's a rate of just under, it's 592 per 100,000. The state's rate is 1,406, so we're about 2.3 times less lower in our infection rate. Our percent positivity of testing is 8.9, the state's 15.9. So again, we've been doing better than the state average. Hospitalizations, I like to show this one. We continue that trend. That trend's been going for a while now. And we're down 47, 90, we're up 27 on one particular day. And those sort of fluctuations could happen if a particular, let's say, long-term care got a lot of cases all at once. But currently hospitalized 1637, that number is definitely down. Long-term care, 22.3% of all cases has been associated with long-term care, with 63.4% of all deaths. That's actually slightly higher than it was. It was always right around 61, 62 when I've been doing these. It's been 63, this up 1.4% from last one. You can see our nursing homes, we've had some cases, obviously, greater than 30. They do it in increments of 10, so 0, well, not by 10, but 0 to 10, 11 to 30 cases and greater than 30. So Royal, between workers and employees and residents, are over 30. There's been 6 deaths. Between 1 and 4 at JML with a caseload of 11 to 30, and Royal McGann's it's been less than 10 with no deaths. So again, those are the battles that we continue to play. The counts stabilized at Royal, and JML is working hard as well. As far as hospitalizations in Barnstable County, you can see that if you look at 4/21/20, you see we had 46 and 13 hospitalizations and ICU beds used. Now we're down to 10 and 4 with 5 in each hospital as of the 3rd, and 3 in ICU at Cape Cod and 1 at Falmouth. So those numbers have gone down. The COVID unit on Main Street, I don't think they're using it right now because the counts are low. So that's good. That's the trend we've been seeing in the state, and it's definitely been the trend here on the Cape. As far as testing, this slide's been in there for the last month or so. Again, Monday through Saturday, if you need to get tested. Your physician still needs to schedule, and it's at the 4 Cs, and that has not changed. That is your molecular test, your nasal swab test, the one that actually tests for the virus. Okay, so the data was good, and it's trending in the right direction. So now we're at the reopening guidance. The state continues to add sector-specific guidance. You visit mass.gov for your sector-specific rules. They're being added daily. I'll get emails and say, ooh, they just did this one for the pools, and they just did this for rec camps. So if you have a certain sector, you're a business owner and you want to look at the guidance, or anybody from the public wants to look at the guidance, they're on there. The website's getting to be quite a bear. It's getting really big, but it will take you a few minutes. It takes myself quite some time to sort of get through everything. I've got a lot of bookmarks, but there's, guidance keeps growing by the day. Tomorrow on the 6th, Governor Baker should be given a Phase 2 update, which could start as early as June 8th. So what was the things that they're talking about is outdoor restaurant seating, retail, lodging and short-term rentals, rec camps, sport fields, parks and outdoor practices, and semi-public public outdoor pools. And the outdoor pool one we just got yesterday afternoon. And some of these are quite big. Rec camp has 32 pages, for example, of guidance. So there's a lot of guidance out there. And if you need, what the health department does is you do the guidance, you do it on your own, and then from there, we'll deal with complaints and help with the questions and so forth. So you self-certify, and we go from there. And so you need to adhere to all the guidance. We're here to answer any questions. In terms of restaurants specifically, the beginning is going to start out as outdoor only. The Board of Selectmen last night approved an expedited permitting process for additional outdoor seating, changes in parking. For example, you might be wanting to put seats in your parking area, alcohol service, tent installations, those types of things. So the town manager's office is going to send out details to the establishments today, and we're here to answer any questions, but we're trying to go through a very quick and expedited permitting process for things such as tents outside and so forth. Tents are allowed to be outside as long as 50% minimum is open at the bottom, or the sides rather is a better way to say it. So that'd be like no less than 2 sides. You have to have no more than 2 sides rather covered. But so 50% it can be enclosed on the sides and top obviously. And so that sort of process is going to be streamlined. Because if you had to go through ZBA, the Zoning Board of Appeals, and the Planning Board, it would take quite some time to go through the process. So our town council and the Board of Selectmen and town manager got together and they figured out a way to do it. And so those things, you know, are important to the restaurants, and so there's guidance on that, and that'll be coming out today. And of course, it's going to guide, the guidance are 6 feet between the tables of the parties, strict social distancing, mask wearing, things of that nature. And the guidance, again, is on the website. If you happen to own a restaurant, I want you guys, you should be getting on that pretty quick if you plan on taking advantage of it and getting in line, getting on that pretty quickly. And of course, the health department's here to answer any questions that you might have. Again, beaches, I kept the slide on for the last couple of meetings. Still at 50% capacity. You can get it online, by mail rather, if you visit the website up here, which is Falmouth, Mass. Beach parking stickers. You can also get it at the bathhouse at 56 Surf Drive, began on May 26th. So that's it on that. As a recap, the state metrics are still on a downward trajectory. Falmouth cases are very good. We're very low. Cape cases in general are doing quite well. Tomorrow, if you want to see if we're going to open phase 2 up, you want to watch Governor Baker's announcement tomorrow and give us some more guidance on what can and can't open. If you're one of the businesses that can, grab the, you know, if you haven't already, if you don't have guidance, hopefully we would have it by then. But if you've got guidance, you should be working on it so that we can get everything up and running as quickly as possible and safely as possible. And again, the beach parking lots are open if you don't know that. So that's what I have this week. We're doing well. Hopefully we maintain that trajectory, and we'll talk to you next week. Thanks.